Hi, good morning. My name is Rob Ralston. I'm a business development executive here at XTIVIA, and thank you for joining our MuleSoft webinar today. The 21st Century Cures Act of Healthcare is a transformative rule that allows providers, payers, and technology vendors to design their systems to give patients safe and secure access to their digital healthcare data. Since its enactment in 2016, the Act has had a significant impact on healthcare providers, patient interactions, and overall patient experience. The Act's most critical achievement is how it's accelerated innovations and product development in the medical field to service patients in need of the latest healthcare tech. In our webinar today, XTIVIA's technical architect, Manny Roy, will explore how to design a patient-centered system using MuleSoft Accelerator for healthcare for FHIR compliance. Following the webinar, there will be a Q&A session. So with that, I'm going to turn this over to Manny. Manny?
Thank you, Rob.
So these are the agenda we have for today. We will discuss the rules, ONC and CMS rules, and we'll explore the accelerators offered by MuleSoft, catering to this rule. And we'll also look into a few of the artifacts provided by MuleSoft, which is straight away mapping to the ONC and CMS rules. So before I get into the slides, so let's talk about what exactly is happening, right? So this is a landmark rule, which is kind of focusing completely on interoperability. I mean, you guys might be already aware of other interoperability rules like HIPAA, right? HealthCare Information Portability Act. So HIPAA is already out there, but these new interoperability and portability rules kind of takes it further, and with a key message behind it. What it's trying to do from the ONC. ONC is the Office of the National Coordinator for Health Information Technology. It's healthit.gov. So that's the standard body. And what they have done is basically delivering on the patient's right to their medical records, and in a way promoting the modern health app economy. So, the focus is on the patient. If you look at this diagram to my right, this is the patient, and everything is revolving around the patient. That picture was different, a while back, but putting the patient in charge has a lot of benefits. And let's talk about the benefits specific to patient, and how it kind of is a, innovation on the healthcare industry side. So first thing is, what happens, the major benefit to the patient is like it kind of provides high transparency for the care being provided, and that allows the patient to kind of accurately choose plans that work best for them. They can shop around and choose what is right for them. So more power to the patient. And the same way, it kind of gives patient an array of options for Medicare, medical care, making shopping easier and more clearer. These are the key highlights revolving around patients, and the convenience factor is also kind of leaning towards the patient, where there are health information apps where you can do your visualizations, and an app will provide a one-stop kind of a solution for many of the things within the healthcare IT system. And all the three things is mostly for the patient, but one thing which stands out, it's how it is kind of focusing on an app-based economy. I mean, nowadays we all know the app economy is huge, what it was before, and it's not just limited to financial services, which kind of pioneered that app-based economy, with an open banking philosophy and standards around it. Third parties getting access to the to various other participants in the ecosystem, and there in financial world, your consumer is the core of the ecosystem, right? So similarly, so it's a kind of healthcare kind of took a leaf out of that page and kind of put that in healthcare perspective, and the patient is in charge. So what it does, kind of provides an array of innovations not just to patient. We know patient is at the center, but with that ecosystem, everyone gets benefited. Be it the physicians, hospitals, payers, and employers. And let's take a deep dive into how each of them is getting benefited. So let's start with the patient. The major thing for patient is like now they will have access to their chart, their electronic health chart, in a pretty modern way, an app-based way, which is out there, but again, it's going to democratize that access for the patient. And at the same time, access doesn't mean you kind of get away with the privacy and security. So this ensures that privacy and security is in the core hand of the patient. So that's a key aspect of that. And all the while, enabling the ability to shop for the care and manage the cost. And let's look at on the provider side. If you are a provider, so how is this is going to benefit you, right? So what happens, as we're enabling the patient to get access to their charts, so on the provider side, it should be an easy way to kind of provide that access to the health record, which is requested by the patient. And that doesn't have to be expensive, right? So what the benefit it offers is like inexpensive data access request by the patient. And from a provider side, what it allows also the choice of software. Now, we'll talk more into how exactly that's happening, because now the whole interoperability, kind of focusing towards standard based, with the new standards being launched, it's kind of puts the providers in a driver's seat to kind of choose the required software they want to go with, because it's no longer tied to a legacy protocol or kind of that health IT provider specific format. It's now open, it's standardized, so you get more choice in the marketplace. So as a provider, that's a big boost for your business. And all the while, uh, patient safety is at the core, as I talked about in the previous one. For the patient, it still remains the same. It's not discounting the factor of the safety and privacy and security. And if you are a health IT developers, for example, Epic or Cerner or Athena Health or any other health IT developers, like even us, right? We are a partner to MuleSoft or somebody who is leveraging this technology. If you are a health IT developers, what does it mean to you, right? It means a lot because now your API development and maintenance costs are going to decrease a lot, because now you're following a standard-based API with FHIR, release R4. Now, if everything is standardized, so it's pretty much cut down your cost. You don't have to do that legacy-specific integration over and over again. Like everybody talks the same language, so development cost goes pretty low. And at the same time, you're respecting the intellectual property. Okay, let's look into. So we talked about the ONC rule given by Health IT, and this is a body, it's a government body, right? ONC, and another one is CMS, Centers for Medicare and Medicaid Services. So they have also additional rules in the same direction of interoperability and kind of providing more feature or access to the patient, right? CMS 9115F, these rules are published way back in March, April timeframe, and this has a implementation timeline for almost next 3-4 years. So there is time, and there are different milestones when you have to achieve these features. So let's, I think we talked about what is the need of the interoperability and patient access. Let's get deep into the 4 key areas, which is kind of relevant for, for someone who is into the integration API management side of things. There are broader rules, it's just a subset. There are additional rules, which kind of talks about visualizations. That's something you can do it by any kind of visualization tool, like reporting tools, Tableau from Salesforce, for example. But we're pretty much focusing around MuleSoft here. So these 4 are the key. And these 4 are the key rules anyway from CMS. So patient access API, what it does, allows patients to access encounters and claims info through third-party applications. And we'll see how it's being done later on. And provider directory APIs. So it provides information about available provider networks in a very standardized way. And the third one is payer-to-payer data exchange. So payers are required to exchange certain clinical data at the patient request. There is a subset of clinical data, there's a whole list of things, and each of those clinical data has its own data model. And so they're required to do that data exchange. And all the while being following the standard in a very standardized way. And that's the key here, standardized way. And the fourth thing is admission, discharge, and transfer. We call it ADT event notifications. What it does is sending electronic event notification of a patient's admission, discharge, or any a transfer to another healthcare facility or a community provider or a practitioner. So the moment it happens, the notification goes out. So we talked about the different rules from ONC and CMS. Now let's talk about what is MuleSoft doing kind of to help their clients to kind of adopt or be compliant with these rules. And this is something called accelerators in MuleSoft terms. What it does, it kind of gives you a head start. It kind of pretty much gives you a head start, does a lot of boilerplating code for you. So, you simply focus on your specific implementations or your specific changes. But many of the things, if you look at just what just happened, right? The health information technology or the ONC and CMC, they came together and they published their own set of rules, which kind of takes that the legacy integrations, typically like traditional legacy-based specification away and put a standardized specification in place. So they are making that side of the things easier on the business side. And what MuleSoft is doing, they're making your technical side of things easier by providing an accelerator. So in a way, things are getting better, and your the burden of implementation is not too much. The barrier is lower, so that everyone can participate in that ecosystem. And MuleSoft with this accelerator kind of helping you provide many of the pre-built APIs, integration templates, reference architectures, and even a full-fledged data model. There are almost 200 plus artifacts available within MuleSoft Exchange. A very broad number of artifacts out there. All you have to do is go there, type HealthCare, go to Exchange, mulesoft.com/exchange, publicly available website. Just go there and type HealthCare, and the link is given here, and you will see this one first. And that I would recommend you to, there are, as I said, 200 plus artifacts there, but your first stop should be this accelerator, because that's your gateway. That's your entry point to everything in detail about it. And ultimately, the MuleSoft Accelerator pulls. If you look at the left-hand side, this diagram I'm talking about, what it does, it's kind of a sync between your EHR and Health Cloud in a way to offer you a 360-degree patient profile. So in that way, if you look at the left-hand side, you have many information blocks like patient demographics, conditions, allergies, observations. All of these are pushed to the Health Cloud from your EHR in a standardized way, published to your health. This is the Salesforce Health Cloud. So this way, your information are in sync, and you get a complete 360-degree view of the patient profile. Okay, so let me move on to the next one. And so continuing on that accelerators for healthcare, there are two use cases pretty much. We just talked about the patient 360 assets, and MuleSoft offers both the ways for consumption. It has HL7 standards. It has FHIR R4 standards. So both of those are available to you. And the second use case is what we are talking today is around CMS interoperability assets, directly mapped to the specification we just talked about, those four: patient API, provider API, and payer data exchange. So we'll explore that shortly. Okay. So this is what we are going to do now. So we're going to focus more into the CMS interoperability rule, patient access rules, and with these four things, we'll see how MuleSoft is implementing it and what is available to you. And as I mentioned before, these are published artifacts. There are specs. There are implementation template, which is already done for you. As you see here is a reference architecture. So all the way kind of increasing that time to, I mean, cutting down on your development lifecycle by leveraging the templates out there. So this is the FHIR standard release for patient API, and that's a standard as mentioned by CMS and ONC. The version is R4 as of right now, and what you see here is the by EHRs are providing a patient API, and which is kind of hosted on Mule, and what Mule does. Using that patient API, which is a standardized way, it kind of upserts in the health cloud and get a response and back into the EHR. So in a way, it's pretty much syncing the patient informations between your health cloud and EHR. And health cloud is just, it doesn't really have to be Salesforce Health Cloud. You can bring your own whatever health cloud offering you have, and because these are standard based. So all you really have to worry about is how to connect from MuleSoft to that health cloud offering what you have. But everything else from EHR to Mule is standardized based on FHIR R4. Because it's a FHIR R4 spec, it can be integrated to any of the cloud offerings for healthcare side as you wish. And next one is the ADT events, admission, discharge, and transfer event notification. And so the provider directory API template, what we see here, enables rapid consumption and storage of HL7 v2. And remember, this is HL7 v2, and again, there is also a FHIR spec for it. So HL7 v2 admission, discharge, and transfer data with the Salesforce Health Cloud. And the pattern is what is shown here is a completely asynchronous pattern, because these are event notification, as the name suggests. It doesn't have to be synchronous, it's all asynchronous. And MuleSoft is leveraging its own Anypoint MQ for sending that event. But you are free to choose your own JMS implementation or your messaging implementation, but this one is just leveraging Anypoint MQ because it's all MuleSoft here. And what also this implementation template offers you a reference guide to HL7 connector, implementation to parts and write standards, and custom HL7 segments. And so this is the reference architecture for that, and the complete implementation template. And next thing is the provider directory API. So this one has, as I mentioned before, we were talking about number 2 and 3 pretty much here: provider directory API and peer-to-peer data exchange. So there are two aspects of the directory API, and as I mentioned before, the primary aim is identification of individual providers and provider organization, which is critical, and kind of in a way backed by the provider directories. The patient can find providers and learn characteristics about them and their expertise, right? So that will help you choose the kind of provider you want to go to. And the provider directory support a variety of use cases, and one is the patient payer focused, and pretty much a basic information exchange, which is kind of gearing towards peer-to-peer data exchange. So if you see here on this architecture diagram, we have a provider information database. And again, this is also in template. You can start using it. And if you see here, there are different segments, so like location, practitioner role, practitioner organization, healthcare service, insurance plan. All of these are specific APIs exposed by MuleSoft. And kind of they are, again, there's one more API, provider directory API. So, and that is what the consumer is going to access. And all these data will be also synced to the pairs. So that's why you see this segmentation of the lineup or the data model here. Okay, so I think with that, we come to the conclusion of the presentation, but I would like to leave you with one thing here. In my expertise or experience with working with a lot of healthcare clients, it was always about, traditional way of, consumption of data, be it a flat file, be it some kind of very specific formatting of the file with the EDI spec. Those were the traditional days of integration between a healthcare to its payer or the consumer or the provider. That's how the ecosystem used to be, pretty much file-based. But with the launch of the standardized way of consumption using FHIR R4, things are now API-driven or API-led connectivity, right? Which makes healthcare in a very innovative path, and at the same time, kind of empowering the patient. At the other side, kind of creating a larger ecosystem around the healthcare industry side, which is kind of doing better and more offerings in the hand of the patient. With that, I would like to conclude.
Manny, great job. That was very informative, and I learned a lot today. Thank you. We do have some questions from the gallery here. Are you ready to answer a few questions?
Yep, go ahead.
Okay. So question number one, what are the healthcare standards supported by MuleSoft?
So MuleSoft is an industry leader, right, when it comes to integrations and API management. So, and it supports a wide variety of standards when it comes to healthcare. Two of the major standards it supports is FHIR, the first Healthcare Interoperability Resources, FHIR, and HL7, Health Level 7. So these are the two standards widely used and supported by MuleSoft.
Okay, great. Question two, what are the advantages and disadvantages of using the Salesforce Health Cloud versus other health clouds?
So Salesforce Health Cloud, it's a CRM packaged in a kind of cloud offering and called a Salesforce Health Cloud. And but there are other enterprise health clouds, mostly on a infrastructure as a service or a platform as a service offering. But what we're talking here is a software as a service, the SaaS model for health cloud, which is offered by Salesforce. In that specific segment, there are other players, well-known players. One of them is Pegasystem. There are others like HealthCare, Sugar CRM. They also have similar offering, as well as Microsoft. But what kind of keeps Salesforce Health Cloud apart from other competition, I'm talking about the advantages, is primarily around, it's all about the interoperability, what we just talked today, right?
Right.
Salesforce leads the pack when it comes to interoperability standards, configurability standards, and all the help is given by the MuleSoft, which is a well-known API management platform offered by Salesforce. So it leads in that segment, and that's the major advantage to my viewpoint. When it comes to the disadvantage, Salesforce is kind of a new entrant on the whole the healthcare vertical specific capabilities such as healthcare, and it still has to build more offerings in that vertical of the healthcare. So whereas if you compare to the question was what are the advantages and disadvantages, right? So when compared to Pegasystems, right, which is out there kind of pretty mature in terms of the vertical specific or healthcare specific offerings, has built on many out of the box capability. It has a well integration platform connecting to Epic or other EHRs, and the key feature is it's not new, and it has much more depth in terms of the offering in healthcare when it comes to Pegasystems, which is a major competition for Salesforce Health Cloud.
Okay, that was a lot of information. Wow, great job. Okay, the final question we have is, does MuleSoft have matured connectors to integrate with FHIR?
So the question is a little different. So the FHIR is not a system. FHIR is a standard, as I mentioned before. Okay. So it's a specification. So you don't connect to FHIR. You connect using FHIR.
Mm.
The system which will be connected is your typical EHRs or electronic health records like Epic, Cerner's, and there's Athena Health. So for those, MuleSoft has already kind of found a industry standard way of connecting. It doesn't have any custom connector for Epic or Cerner's. So these are all based on like a standard connectivity through REST APIs.
Okay. That's all the questions we have. So again, great job today, Manny. And I want to thank our audience for joining us today. This will be recorded and put onto our company's website. So with that, we'll let everybody go. Thank you again.
Okay. Thank you.